Greetings, enlightened minds. Welcome to Brainy-tainment, your go-to channel for all things intriguing and informative. We journey through a universe of knowledge, exploring topics that pique your curiosity and challenge your understanding. Our mission? To enlighten your mind, one captivating video at a time. From the mysteries of the cosmos to the intricacies of the human body, we delve deep to bring you the facts. Today, we immerse ourselves in an enlightening discussion about a common but often misunderstood medical condition, gonorrhea. Gonorrhea, an age-old adversary of human health, but what exactly is it? This question has perplexed and frightened many over the centuries. In essence, gonorrhea is a sexually transmitted infection caused by the bacterium Neisseria gonorrhoeae. It's not a new player in the game of human health hazards. In fact, its name originates from the Greek words gonos, meaning seed, and rhoea, meaning flow, a misinterpretation by the ancient Greeks who thought the discharge associated with the infection was a man's seed or sperm. Gonorrhea is a crafty invader. It prefers the warm, moist areas of the body, setting up camp in places like the urethra, cervix, rectum, and throat, even the eyes. Often it's transmitted through sexual contact, be it vaginal, oral, or anal sex, but here's where it gets tricky. Many people with gonorrhea don't exhibit any symptoms at all. That's right, you could be carrying this bacterial hitchhiker and not even know it. When symptoms do occur, they can be mild or mimic other infections, making it a master of disguise. For instance, men might experience a burning sensation when urinating or a white, yellow, or green discharge from the penis. Women, on the other hand, may mistake the infection for a bladder or vaginal infection since it often causes increased vaginal discharge or pelvic pain. To add to its stealth, gonorrhea can also spread from mother to baby during childbirth. This can lead to serious health complications for the newborn, such as blindness. So why should we be concerned about gonorrhea? Well, if left untreated, it can lead to grave health issues, such as infertility in both men and women, an increased risk of getting HIV, and in rare cases it can spread to the blood or joints, which can be life-threatening. Armed with the knowledge of what gonorrhea is, we now delve into how it affects your body. Once gonorrhea enters the body, it embarks on a destructive path. This bacterial infection, often referred to as the clap, is more than just an inconvenience. It's a silent marauder, wreaking havoc in the body, often without showing any symptoms. Gonorrhea primarily targets the mucous membranes. This means it frequently affects organs like the urethra, cervix, throat, and rectum. In women, it can invade the cervix and create an environment ripe for pelvic inflammatory disease, a serious complication that can lead to long-term pain and even infertility. In men, it can cause a painful condition in the tubes attached to the testicles, which could also lead to sterility. Now, let's delve into the symptoms. When symptoms do appear, they can be easily mistaken for a less severe infection. For men, it could be a burning sensation when urinating, or a white, yellow, or green discharge from the penis. Women might experience increased vaginal discharge, painful urination, or even bleeding between periods. But here's the kicker. Many people with gonorrhea exhibit no symptoms at all. That's right. You could be a carrier and not even know it, unknowingly spreading the infection to others. This is why regular testing is so crucial. So what happens if gonorrhea is left untreated? Well, it can lead to some serious long-term health problems. In women, untreated gonorrhea can cause pelvic inflammatory disease, leading to chronic pelvic pain, ectopic pregnancy, or even infertility. For men, it can cause epididymitis, a painful condition of the ducts attached to the testicles that may lead to infertility if not treated. But it doesn't stop there. If the bacteria spread to the bloodstream or joints, it can cause a condition known as disseminated gonococcal infection. This can lead to skin sores, joint pain, or even life-threatening infections in other parts of the body. Perhaps the most insidious aspect of gonorrhea is its ability to increase one's susceptibility to HIV. Yes, having gonorrhea makes you more likely to contract or transmit the HIV virus. It's a dangerous domino effect that underscores the importance of prevention and early detection. Gonorrhea also poses a significant threat to newborns. If a mother has gonorrhea, she can pass the infection to her baby during childbirth, which can lead to blindness, joint infection, or a life-threatening blood infection in the baby. The effects of gonorrhea, as we've seen, can be severe, but it is not a life sentence. The good news is that gonorrhea is preventable and treatable. That's why it's so crucial to get tested regularly, especially if you're sexually active. Remember, knowledge is power. And in this case, it's the power to prevent, detect, and treat a potentially harmful infection. If gonorrhea is the problem, then what is the solution? The answer lies in early detection, effective treatment, and diligent prevention. Let's dive into these a bit further. Firstly, treatment. Gonorrhea is primarily treated with antibiotics. The type and dosage of antibiotics may vary depending on the individual's overall health, allergies, and whether they have any other infections. It's crucial to complete the full course of antibiotics, even if symptoms subside earlier. This ensures that all the bacteria are eliminated and reduces the risk of developing antibiotic resistance. It's important to note that antibiotics can cure the infection, but they can't reverse any permanent damage caused by the disease. That's why early detection is so vital. Regular testing for sexually transmitted infections is recommended for anyone who is sexually active, especially those with multiple partners. The sooner gonorrhea is detected, the less damage it can do to your body and the more effective the treatment will be. Now let's talk about prevention. Prevention is always better than cure, as the old saying goes. In the case of gonorrhea, prevention means practicing safe sex. This includes using condoms consistently and correctly during every sexual encounter. It's also wise to have regular sexual health checkups and to have open, honest discussions with your partner or partners about sexual health. Another preventative measure is vaccination. While there isn't currently a vaccine specifically for gonorrhea, getting vaccinated against other sexually transmitted infections can help maintain your overall sexual health and potentially reduce the risk of gonorrhea. And lastly, education. Knowledge is power, especially when it comes to your health. The more you know about gonorrhea, how it's transmitted, its symptoms, and its potential effects on your body, the better you can protect yourself and others. Remember, gonorrhea, like any other sexually transmitted infection, is not a verdict. It can be treated, and more importantly, it can be prevented. You have the tools at your disposal: antibiotics for treatment, testing for early detection, safe sex practices, vaccination and education for prevention. With early detection, effective treatment and prevention, gonorrhea can be managed and even avoided. So stay informed, stay safe, and take control of your sexual health. Gonorrhea, like many other diseases, thrives in the shadows of ignorance. We've journeyed together through the complex biology of gonorrhea, shining a light on this often misunderstood disease. We've seen how it infiltrates the body, invading our cells and disrupting our normal physiological processes. We've explored the significant health problems it can cause if left untreated, from pelvic inflammatory disease in women to potentially serious complications in men. Understanding gonorrhea isn't just about knowing the medical mumbo-jumbo. It's about recognizing the tangible impact it can have on our lives and the lives of those we care about. It's about breaking down the stigma and starting conversations that matter. It's about empowering ourselves and others with the knowledge to make informed decisions about our health and well-being. We've also delved into the treatments available and the simple steps we can take to prevent gonorrhea. The encouraging news is that with early detection and appropriate treatment, most people can fully recover from this disease. But remember, prevention is always better than cure. Regular testing and safe sex practices are our best defense against gonorrhea and other sexually transmitted infections. It's easy to feel overwhelmed by all this information, but remember, every journey begins with a single step. The first step in this case is understanding. Understanding leads to awareness, and awareness leads to action. Together we can make a difference, one conversation at a time. Before we wrap up, let's take a moment to reflect on the importance of open dialogue about health issues like gonorrhea. Let's foster an environment where no question is off the table, where we can discuss and learn without judgment or fear. Remember, knowledge is power. Stay informed, stay healthy. Before you go, don't forget to hit the subscribe button for more enlightening content from Brainetainment. Until next time.